What are night sweats and how do you get rid of them? So, welcome back. Night sweats are the symptoms that we get usually at night that cause us to take the bed sheet off because we're too hot, and then minutes later we put the bed sheet back because we're too cold. And we do this repeatedly multiple times a night, and for all through the night we get disruption of our sleep. So we call it night sweats because some patients actually end up drenching in sweat, and that's what wakes them up, and then they take the sheet off and the sheet on. But some patients don't sweat at all, so they don't call it night sweats because they don't know that's what it is. They just feel this heat, and so sometimes patients mistakenly call these hot flashes. They're not the same. The hormones that control these symptoms are different. A hot flash only happens during the day, a night sweat only happens at night. Okay, so that's the difference. Now, what causes it? One of the most common reasons we see this in perimenopausal women or menopausal women or men that are going through andropause, which means that testosterone level is dropped to a certain level. The most common cause is testosterone not being optimal. So you guys might be wondering, well, I'm a female, why should I be worried about the testosterone level? Well, because testosterone, it does exist in both men and women, and we just have them in different ratios. Men are supposed to have up to 1200, while women only have up to 80 maybe so of testosterone. So because of these difference in levels, we typically think women don't have testosterone, but that's not true. In fact, if you watch my other videos on women and testosterone, you will find that women actually have more testosterone in their body than estrogen. Yes. So again, go watch that video so you can learn about that. But today we're talking about night sweats and what causes it. So night sweats, most common cause we see in patients outside of things like an infection from like tuberculosis or viral or bacterial infection is usually testosterone. Okay, so when testosterone level drops below the level that your body feels it needs, you can start seeing night sweats. So one of the fastest way to fix it is just replacing testosterone. Okay, now how do we replace this testosterone? What kind of testosterone do we use? How often do we use? How much of it do we use? Those are things that has to be weighed for each patient. Your doctor really has to check your levels. They cannot assume. They have to check your blood level, see where your number is, and then give you just enough, okay, therapeutic bioidentical testosterone that will bring your level into the optimal part of the range, okay? So, for example, most women, if you have labs done, you will see that the testosterone level is written that it ranges from like say 2 all the way to like 82. That's what we typically see in the labs that we use. So if you go to Quest, for example, Quest Diagnostics, maybe LabCorp, you will see this range. And typically what this means is that if I'm within that range, I'm considered normal. Well, a lot of my patients feel much better when they're closer to that 80 range. And when they're closer to the 2 range, they feel horrible. So here's kind of what I decided to do in my practice. If a patient is symptomatic, they have things like night sweats and other signs of low testosterone, like their libido is down, they have a lot of fatigue, they're having trouble burning belly fat, they feel sore for days after exercising, they have brain fog, all these things, then I'm more inclined to help them bring that testosterone level closer to the end of that range, right? So that they can start experiencing less of those symptoms, or maybe it even goes away overnight. I've had patients that within 3 days of getting their testosterone up feel so much better, night sweats stop completely, now they're sleeping through the night. So that is a quick example of something you can do really quick to fix your night sweat problem. And yes, you can see this even if you're not in menopause. So that is why it's important for us to check the levels and see where you are. I've seen this problem in patients in their 30s, in their 40s, in their 50s, 80s, doesn't matter, okay? If you're having nice sweats and you're not sick, there's no infection going on, you should have your doctor check your testosterone level and see maybe that might be the cause for you, okay? Hope to see you on the next one. Share this with someone that might need it, all right?